Hair is done, makeup is done. Let's go. Right, in today's video, we're going to be talking about blood pressure. The bad news is 1 in 3 Nigerians have high blood pressure. And the worst part about this is 3 out of 10 people who have high blood pressure are completely unaware that they have high blood pressure. So you have people who are walking around and not realizing they have high blood pressure. And usually by the time you find out you have high blood pressure, it's too late. So in this video, we're going to discuss everything related to high blood pressure, especially if you're Nigerian, and the ways you can go around this, what you can do in the gym and what you can do outside the gym to slow down the damages done to your body from high blood pressure. And if you're pre-hypertension, there's things you can do to make sure you don't get to that point of no return. And if you already have high blood pressure, there's things you can do in the gym and outside the gym to manage your blood pressure. Usually there are no signs for blood pressure, high blood pressure, which is why it's called the silent killer. Because usually by the time you see the symptoms of having high blood pressure, it's usually too late. Most cases after having a stroke or losing a kidney. So what is high blood pressure? When your blood pressure is consistently high, what happens is your heart is working over time, and this puts pressures on the walls of your arteries, and it also puts pressures on your kidney. And sometimes, in some cases, you have a little bit of bleeding in your brain. Usually, again, it's something you don't ever notice until it's too late, until you have a stroke. Your normal blood pressure should be between 120/80, which is what we call optimal. If your diastolic, which is the reading at the top, which is usually the one that is about 120, if it's above 139 and the bottom reading, which is the systolic, is above 89, then this is what we call pre-hypertension. What should you do if you have high blood pressure? There's 4 things you need to be aware of that you need to start practicing. The first thing as a Nigerian is to be aware of your sodium intake, which is usually from your salt. Our food is very delicious, which I'm very aware of, but one of the downsides of our delicious meal is the amount of seasoning we have in it. So it's not just the salt, it's the Maggi cube, it's everything. As much as you can, if you're pre-hypertension or you already have high blood pressure, you need to reduce the amount of seasoning and salt you use in your food. The second thing you can also do is to reduce your alcohol intake. If you're someone that drinks a lot of alcohol, you need to reduce your alcoholic intake by a lot, or if possible, stop drinking alcohol completely. Another thing you can do to control your blood pressure is to be aware of your potassium intake, which is what you get from banana, avocado, and sweet potato. Potassium is good because it helps to balance out the sodium in your body. So if you're going to be having salt and seasoning in your food anyway, having things like banana, sweet potato, and avocado helps to kind of balance out the amount of sodium in your body. So make sure you increase your potassium intake. And another thing you need to be aware of is your sleep and your rest. Making sure you have minimum of 7 hours sleep every night and reducing the stress. So reduce stress by doing exercises, doing things that helps you relax, and making sure you sleep minimum 7 hours every night. Now, this is where it gets really interesting. Everything we've discussed so far is everything you should be doing outside the gym to control your blood pressure. In the gym, there's things you should be doing to help with your blood pressure as well. For a long time, doctors used to tell anyone who's trying to control their blood pressure to just walk on the treadmill in the gym. Now, this is valid. You should be doing some kind of cardio to help control your blood pressure and to work on your cardiovascular system. But there's been a research done recently by Columbia University, which involved 270 clinical trials and involved about 15,000 people. So this is a very well-rounded research, which I'm going to add in the description below. And this research found that the exercise that helps the most, the kind of exercise that helps if you're trying to control your blood pressure, is something called isometric exercises. Now, what are isometric exercises? These are exercises where you get to hold a certain position, so your muscles are working in that position, but your body is not moving. Okay, these exercises are like wall sit, squat hold, plank. These are the kind of exercises you should be doing to help with your blood pressure. Obviously, you do everything else, you do your cardio, but you should absolutely include isometric exercises into your training. So why does isometric exercises work? When you do isometric exercises, when you hold, say you do a squat hold, during that period where you're holding for, so you're doing 20 seconds to 30 seconds, while you hold that exercise, there's a restriction of blood flow to certain parts of your body. Now, if you hold for 20 seconds, once you stand up and release, you get a rush of blood flow through your body, which stimulates your blood vessels to release something called nitric oxide. Now, nitric oxide is what helps your blood vessels to relax and widen. And over time of training like this would help to train your cardiovascular system to operate at lower blood pressure. So what should your training program look like if you're someone who's got high blood pressure or you're pre-hypertension? Your training program shouldn't be the same as someone who's trying to gain muscle mass or someone who's just trying to lose body fat. So your training structure should look like this. The first thing you always do is warm up. You don't want that sudden rise in your blood pressure, so you don't go from stepping into the gym to just running. So you do steady walk, nice and low intensity exercise. Always start to warm up. I would say to do some kind of cardio every single time you train. In the span of a week, you should be doing minimum of 120 minutes of cardio a week. And I would say to spread that out evenly. So if it's 30 minutes, if you're doing 4 days a week, spread it to 30 minutes on each day, okay? So you start with your warm up, do a little bit of cardio, slowly get your heart rate up. And then I would say to always include isometric exercises into your training. So that's the squat hold, static lunges, plank, any kind of these exercises, always include them in your training program. So, and this should be maybe about 4 rounds of each exercise, and each round you hold for about between 20 to 40 seconds, depending on your fitness level, okay? And the last thing you always do is to make sure you cool down as well. As you start to warm up, to make sure your heart rate doesn't suddenly shoot up, your blood pressure doesn't rise suddenly, you also want to cool down to make sure your blood pressure doesn't drop suddenly. So you start with your warm-up, you do a little bit of cardio, you do your strength training and include isometric exercises into your training, and at the end you finish with the cool down. Relax your muscles and stretch out. So to round up, always get your blood pressure checked and reduce your sodium intake, which is your salt and your seasoning. Include your potassium intake, which is your banana, your avocado, your sweet potato. Include isometric exercises into your training. And remember your structure, your warm-up, your cardio, your strength exercise, and always finish with a cool down. And make sure you're taking your medication. If you're on medication for high blood pressure, keep taking your medication even if you feel better. You're only feeling better because you're taking your medication, okay? So good luck with your fitness goal. That's all for today. Odabo.